Actually, for me, Mamuna Ajo, me Mamuna Akwaba, I want to welcome every one of you joining us right now. And then yedi Juma Stronko and Bremo. This is a special program, special edition. Columbus Ghanaian Church yedi eba na ya to this special edition no edin say healthy nugget, healthy nugget. Apomdi ehun here. This is a quote Mitai Ekam. We were being for be any kind was say health is no value unless sickness come. Because of that, and and was a menu ye bo ya bomudin and who by so yaria and our bones say yari hui ya ye pa sabria or and qua now this is the time you need to take good care of your health. And then some couple of weeks but on my story, there is this special edition but I actually doing healthy nugget. Kwaya mene umienu wapomuden ho nsem ebetimi akoso. We're going to have a couple of health lecture series from doctors. Yebe yensa ya tunsa Fred doctors omo specialize ewo akomemu cardiologists ne. We have a lot for you. In fact, you have already special doctors omo America ha and this week and a couple of weeks banom omo this special health program yi ebebre. Now the first person ene yene no eba be sha ase no enye obia se Dr. Robert Okyere. Dr. Robert Okyere. Mamema on na bakosem kakra. Dr. Robert Okyere eye cardiologist or your doctor ni a ono wasa specialize ewa akomam ti wo wakoma no de to nsem say a obetimi aka de ekoso yi na anye no ko a wosa advance ɛwɔ cardiologist no in fact oguso another aspect I know your friend cardiac imaging doc sɛ metia no wakyerɛ me yie advanced cardiac imaging and also was a year no so ho adesua no so wɔyɛ ho fellowship nti akoma no deɛ ɔde to n'anim no obetumi ama yɛ ho no nyinaa nti doc ɛbɛyɛ the main leader for this healthy nugget yɛne no ɛbɛtwetwe nkɔmmɔ afei there will be other doctors ɔmo nso ɛbɛba na yɛne ɔmo atwetwe nkɔmmɔ kasa ne mu no ebi ɛbɛyɛ brɔfo ebi bɛyɛ twi na mo asiesie mo ho saa ɛnam the speakers yɛnsa ɛbɛtumi aka no nti officially Dr. Okyere mema wo akɔ aba.
Oh, yeah, Ija Pastor, that's a plan for having me on this platform.
All right, sɛ biribiara bɔkɔ deɛ.
Yeah, me, I don't be able to call. Pacho
All
be
right.
able to answer.
Nyankopɔn adom biribiara ɛbɛkɔ. Mo a monim no ɛyɛ Dr. Robert Okyere. Okyere no it sounds and as a ring a bell ɛyɛ elder Kwabena Okyere ɛba ɛna Awurade ɛde no do some pepper so nti doc my quick overview I know say maka nneɛma bɛn na yɛnhwɛ anim for the upcoming series and as a series a yɛba bɛyɛ concerning yɛ apɔmuden quick one na afei yɛnhyɛ ase.
Okay, that's a Pambian pastor. And very good evening to everyone watching us. Yeah, you must say Matiki time what they're hearing. That segment we send a pastor Sika, for a healthy nuggets. Now the goal you say bit me educate na you see more about your pomodin. Now you say kind of say a pomodin a stronger and it's me boy me to serve each other well. It's to me boy me to me some yanko point ye. Into a empire any objective say as we kind of learn about our health, we'll be able to share with others. And CBA or any question beyond so I'll be to feel free. Now I'll put it in the comment section. You share we can always go over the questions in T. And Pible CBT me share be free like my boy strengthen your someone so.
All right, Doc, thank you so much. And then which aspect are we looking at today?
And then Nanka a very broad overview of cardiovascular disease. Yeah, a cardiovascular disease. I mean, say in we of it before. You can what does it really mean? It's a very quick broad overview, and then kind of in the next couple of weeks, as we kind of get to meet, you bit more get into a little bit more detail into kind of the different topics within cardiovascular disease.
All right. Any yebesha city doc major amount na fe wa me hu e brand through yebeba Nancy misa one or two be no menso media but any question be feel free to put it in the comment section or na yebekin kan na fe doctor and so ano amai. All right, doc.
All right. Me that's it. All right. Let's share my screen now very quickly. All right.
You're good.
All right. All right. Since you patras, since you kind, and a topic near cardiovascular disease. Now, when outline of kind of the topics or kind of the details we'll go into regarding cardiovascular disease. Into case cardiovascular disease, you mean by that? Into kind of it goes to kind of tell more about kind of different constellation of yarehodwa, including your coronary heart disease, stroke, heart failure, and a peripheral artery disease. Diseases we coming together. Am I with an umbrella term of cardiovascular disease? Now, one of the kind of the leading causes of premature morbidity, meaning say ABA for any symptoms. And I say nipe will before omo time nyankopon ahye amomo say e was bibusa etomo. Inti a kind of a very prevalent disease, very common both here and also kind of in Africa and almost worldwide. Now, it's also one of the big and the biggest leading cause of death for Mema, any kind of different people from different racial backgrounds and ethnicities. Now, in 2022, based on statistics, now 1 in 5 deaths was attributed to heart disease, meaning that about 20%. It again is speaking about how prevalent and how common a cardiovascular disease is. Into the more itimi more about it, no, itimi nyoma ibitimi prevent yen from see binyasa yarewe no, ibitimi boy itimi level a healthy life. Now, in terms of kind of the different factors contributed to cardiovascular disease, no, your table we are a try and the 5-year cardiovascular risk per 100 people. Until 100 in 5 years, no, what are the risks of nipa coronal or more develop cardiovascular disease? No, into reference bar we know mainly referring to ubia 50-year-old woman cholesterol level okay smoky and the blood pressure into kind of bars we already meaning no hanom say blood pressure looking at the systolic blood pressure whether it's 110 130 150 or 170 mainly kind of speaking to increasing blood pressure into looking at the reference bar no in 5 years looking at 100 people no nipa be kind of bear 4 or 5 and a at risk for developing cardiovascular disease. Now, as we go from the left to the right, here, Jomacho Hanomno refer to total cholesterol. Any ubio is smoker, any HDL cholesterol. Because about this in a little bit. Any gender, any diabetes, any age. Into the way catching say cholesterol level, total cholesterol is higher. As for blood pressure, no, a cholesterol no, or 5-year risk of developing cardiovascular disease and so becomes high. On top of that, say we a smoker now cholesterol is higher. We can see say the risk of developing cardiovascular disease increases, and kind of we get the sense and the trend of what this bar is telling us. Saying basically a 60-year-old and a cholesterol level a high or smoky and a good cholesterol low or bema or diabetes or DNA blood pressure no was and the risks will be cardiovascular disease are much significantly higher. Into when different risk factors are contributed to say you be develop akumayare. Now, in terms of nyoma, it increase risk of developing it no. It be pertaining to family history. It's a bit more honoma kind of as part of kind of in the context of a more genetic history, I am more predisposed to developing akumayari, and the definition you use it for it, in terms of kind of ASCVD, atherosclerotic cardiovascular disease. Usually say ABA, BEMA, or family, and in your family referring to the first degree relatives, meaning parents, siblings, or children. Say obi honum BEMA edi less than 55 years, and I say oba edi less than 65 years. Now, when you have cardiovascular disease, you're friend of premature, and that can increase the risk of those first degree relatives, again, being children, siblings, or parents of them developing cardiovascular disease. Another kind of risk factor, and so your cholesterol. In him say a DDA it may contribute to your cholesterol levels, but sometimes to genetic aspects also can contribute. In your friend or primary hypercholesterolemia, it be more genes be or predispose or more cholesterol higher than the ordinary person. Now, in those kind of contexts, now you look at the bad cholesterol, your friend LDL. So usually a more than 190, I know yeah, kind of a really big marker say when for corona, the risks will be develop significant blockages and I say disease and when the coronaries no and when much higher. Other things I bit may increase the risk of developing cardiovascular disease, a metabolic syndrome. A metabolic syndrome, a collection of different um, salient points, and also increase your risk of again developing cardiovascular disease, and that includes say ABR waist circumference, or check your waist. Now waist no kind of circumference no, and I say a bigger, and I say in so belly kind of a kind of on the larger size. It's speaking more about kind of having adipose and I say fat tissue. I know you one risk factor, and I say triglycerides, which are a type of fat, and also a higher blood pressure, your sugar level. Nina, you're kind of part of the markers a bit may increase your risk of cardiovascular disease now. Other things also include chronic kidney disease, and I'm sure say kind of in one of our upcoming lectures we'll spend some time talking about kidney disease, but that's one of the risk factors. And inflammatory disease, to say rheumatoid arthritis, lupus, HIV, and in the cases of women, any history of premature menopause. Definition of that being that you get your menopause before the age of 40. And I see more honoma or more develop a pretty significant hypertension and your friend of preeclampsia. And also it may contribute to the risk of cardiovascular disease. And as some ethnicities, and so kind of they are predisposed to having kind of a higher risk, more so with the South Asian, those with South Asian ancestry. And there are many other kind of biomarkers and also to contribute to the risk of or an increased risk of cardiovascular disease. Now, in terms of kind of knowing our risk factors, we know the good thing is say so when you not me be to prevent yourself from getting kind of or mitigating these risk factors. I know me prevent early death. Now, within the past 40 years now, because of aggressive treatment, with regards to side risk factors, I kasa about whether it pertains to smoking, and I say treating blood pressure, and I say cholesterol levels, ni na boy itimi prolongate your life. Now, in terms of the risk factors, we'll go through a few of them very quickly. The first one, you best start with a hypertension. And hypertension, according to the American College of Cardiology and the AHA or American Heart Association, definition of it so blood pressure, systolic blood pressure, greater than 130, and also diastolic greater than 80. Kind of the definition. There are different kind of grades of hypertension, and we be later on. You might find the time na yakasa about, but that is the definition of it. Now, usually speaking, according to kind of different guidelines. Say when the 18 years and older, you should kind of undergo at least one time screening for hypertension. Now, as kind of your blood pressure increases, especially kind of the systolic or diastolic pressure, if it's more than 20 millimeter increase, that can significantly increase your risk of cardiovascular disease. Into hypertension, a big risk factor for cardiovascular disease. Another risk in terms of hypertension, actually, in terms of management, there are many things reduce your risk of having elevated blood pressure. One of them, a weight loss. Inti say utimi lose weight. Typically about utimi lose 1 kilogram. It may reduce or blood pressure by 1 millimeter of mercury. Inti infant will be high blood pressure. It may lose weight either through dietary adherence. And I said through physical exercise now, obitime reducing the blood pressure now up to 5 millimeters of mercury. In terms of blood pressure, 145, obitime reduce it just by losing weight. Obitime reducing it from 145 to 140. And will be on the blood pressure, so you're normal. What me lose weight, obitime bring it down the blood pressure now by up to 3 millimeters of mercury. The same thing kind of, and the same logic goes for these other parameters. With healthy diet now, And here, the example you're using a DASH diet, which is a diet that mainly consists of kind of rich in fruits and vegetables, all grains, and reduce saturated fat. Nti ano wotumi follow diet ɛyɛ rich in fruits and vegetables a wobɛtumi reduce your blood pressure no. So wowɔ hypertension a wobɛtumi reduce no by 11 millimeters of mercury. Nti sɛ you pay attention to the ɛka sisi no a, yɛmfa no sɛ wotumi lose weight, right? Wotumi lose weight again, 1 kilogram of weight loss equals a reduction of 1 millimeter of mercury. Into just by weight loss, nobody may lose 5 millimeters of mercury. With a healthy diet, you can lose an additional 11 millimeters of mercury. Into combining, and that's 60 millimeters of mercury already, right? Into blood pressure, you have 145 millimeters of mercury. Now, between weight loss and diets, no healthy diets, which me taking it seriously, you can go from 145 to 129, which would be a normal blood pressure. And the additional things, and so I bit my amanatima with your blood pressure, reducing your sodium intake into and to me reduce your sodium intake up to just 1 gram per day. And also bit me reduce your blood pressure by up to 5 to 6 millimeters of mercury. Again, with potassium and exercise. And exercise, then so you have different types of exercises. In here, aerobic exercise, which is the one usually say about CBOB nante and I say obi swimming, and also obi ride a bicycle. Now to me, up to 90 to 150 minutes per week. Obi to lose up to 5. Obi to bring it down blood pressure up to 5 to 8 millimeters of mercury. The same goes for these other types of exercises. You can say dynamic resistance, your more push-ups, and I say pull-ups, and I say squatting. Which me, for this amount of time during the week, and I said this frequency, which may reduce an additional 4 millimeters of mercury. And I mean, say as Okyere for and as Christians, yeah, no monster. But for kind of some of our other audience, and also more alcohol, reducing your alcohol intake can also bring down your blood pressure up to 4 millimeters of mercury. Into your heart, just by lifestyle changes, no. See, to me, taking it serious, you might bring it down your blood pressure significantly down, even before, say, you be introducing medications. Into, I know you kind of one thing that we should keep note of. Another risk factor I kind of earlier on, no, diabetes. It's a case of diabetes. The way is he diagnosed, by getting a lab value called hemoglobin A1C. And basically, hemoglobin A1C an average of kind of your blood glucose over the previous 3 months. Now, say A1C, say more than 6.5%, greater than or equal to 6.5%, then it's diagnostic of diabetes. Maybe once it may measure or glucose level from our blood, say greater than 126. And it means so kind of glucose, may measure or levels after 2 hours, say more than 200, and we are diagnostic of diabetes. Now, usually speaking, the guidelines again recommend for screening for individuals between ages of 35 to 70 years old. Are more risk factors, including overweight, obesity, and as other risk factors may increase your more risk of diabetes. No, indeed, that is kind of a recommendation. Tibia with 35 to 70 years old. Now, these risk factors, now you screen for diabetes. Primary care doctor, that's one thing that can be considered. Now, in terms of diabetes and also the management, no, again, lifestyle plays a significant role. Into that table where the you say A1C now you can say an A1C greater than or equal to 6.5% kind of gives you a diagnosis of diabetes. But so to me exercise now to me lose weight a bit more bring it down say A1C from 1 to 2 percentage points. Into meaning say you can see be A1C is 7.5%. Now to me exercise we to me lose weight not taking it serious a bit more bringing it down up to 2%, meaning so we're bringing it down up to 5% or 5.5%, and kind of avoid the complications associated with diabetes now. And we also use certain medications, including metformin and some of these other medicines for those who have diabetes. And the other risk factors is why you can about overweight and obesity. In case of overweight and obesity, I refer to kind of the way I diagnose by looking at the body mass index and I say BMI. Now, and it kind of gives you an idea of kind of the fat, how much fat you have based on your height and your weight. Usually, so be BMI between 25 and 29.9, one per overweight, and anything greater than or equal to 30, obese. And obesity, so you are different classes of it. So you basically are going into detail later on. And in terms of obesity, and so no, kind of as adults, should be screened for it at least once annually. Also, kind of based on the additional risk factors are more. Now, the kind of the higher your weight, the more you also increase your risk of coronary heart disease, and also to me increase your risk. So, before or time na obesity no ankasa mu nso so sɛ get diagnosed anaasɛ wonya saa obesity na ebɛtumi increase your risk of getting heart failure. Obɛtumi anya kind of a heart arrhythmia, yɛfrɛ no atrial fibrillation, anaasɛ sudden cardiac death. Nti ɛwɔ a lot of complications associated with it. And nti na saa weight loss no ɛma ɛho hia so much no. Now, saa overweight and obesity so bɛtumi contribute in kind of developing hypertension, kind of high cholesterol, and also kind of insulin resistance. Insulin resistance no, it leads to sad diabetes no. Now, we should keep a note that kind of a weight loss of up to 5% can significantly reduce the cardiovascular risk. And in terms of obesity, again, just looking at a few things that we can do to kind of reduce our weight. Again, the diet, making sure to avoid ultra processed foods, whether it's kind of sweet, refined carbohydrates. And I say kind of, again, in terms of carbohydrates, white rice, white bread, sweetened cereals. And I say high in saturated fats. That's it to me, including more fruits and vegetables. And a bit more bring your weight down, preventing from getting obese. Now, and also bit more avoid getting those complications that is associated with obesity. And the other risk factor, again, you can find so dyslipidemia, and I say elevated cholesterol. Again, by guidelines, and so the recommendation is to kind of get a lipid screen, and that's how we get cholesterol checked for individuals who are more than 20 years old. Now, cholesterol, there are different types of cholesterol. Maybe I know what to be a friend of bad cholesterol, and no, usually I refer to be a friend of LDL, and that's a low density lipoprotein. Basically, the way saying I had to say transport, and I say kind of car instead of say a better key cholesterol, bad cholesterol within the body. I better get rid of it. LDL, a transport, and I say a car, I carry cholesterol to the blood vessel. I bet me a causes cholesterol. I mean, it's me depositing the arteries. Now, it may lead to issues. Meanwhile, good cholesterol, it carry cholesterol from the blood vessel and from the body and brings it to the liver. So they buy a liver and bit me get rid of it. And into for HDL, good cholesterol. And a triglycerides, fats. Into the fats I did, and I say EBO extra, it gets stored as fat. And the way that it gets stored as fat, triglycerides. Into the more triglycerides you have that can also predispose to having more cholesterol being deposited by the LDL into the blood vessels. And also the total cholesterol, another part of lipid panel now you look at in terms of making diagnosis of dyslipidemia, and that's a high cholesterol. Now, and also so nyoma bit my yamana boa eridisia cholesterol levels again weight loss. It goes back again to lifestyle intervention into weight loss it play a significant role. And then again your DD and exercise. Now, kind of these are a few risk factors now quickly talk about. When you say kind of later on down the line, we can kind of get a little bit more specific with it. Now, the other thing in terms of talking about cardiovascular disease, you start here the another part of it a coronary artery disease. It has a coronary arteries, arteries akumana kasi supply akumano with blood. Right. And there are two main coronary arteries. There's one called the right coronary artery and about your friend the left coronary artery. In T, right one at the blood echo akumano, the bottom part of the heart, your friend the inferior part of the heart. And at the left coronary artery, there were two main branches. Bako supply the top part of the heart, and at the other one, your friend the left circumflex artery supply the lateral part of the heart. The more we'll get a cholesterol deposited in these arteries and only leading to heart attack. Now, in terms of coronary artery disease, again, family history, say, again, for in Mema, who parents and as a sibling, we do less than 55 for Bema and as a 65 for Ba. Now, when you heart attack, no bit my predispose within the family, to getting a heart attack as well. Now, in that context, and normal say, utiki sa diet and exercise, we're taking it serious and between mitigate your risk of getting some coronary artery disease. Now, in terms of symptoms, I'm for tie in with coronary artery disease, usually I'm for describing as kind of chest pain. So it will be in your heart attack, and I say cholesterol, I get a lot when the vessels, usually chest pressure, and it be also when you belly pain, right? Described as epigastric pain. The way you see make side diagnosis now, you different tests, including say omega T EKG and I say echo, and why make side diagnosis now. Now again, just to kind of make it kind of really clear to us now, yeah, these are the blood vessels, right? Into our coronary arteries now, and the blood echo now. Normally, I will say it look like this one over here. Into kind of as a young person, so I want to keep diet seriously, and I say exercise, want to take it seriously. Start cholesterol a bit more build it up gradually, right? Until you build it up to this extent, a bit more unlimited blood from flowing. Until when that happens, that's when people get heart attack, right? And again, it goes back to the importance of diet. Now, I heard in general, Black individuals 32 times more likely to die from cardiovascular disease when you compare to kind of Caucasians or other kind of ethnicities, right? Into way you're kind of looking at the age-adjusted mortality. And I say, it costs penipa 100,000. So the year 2008 and the year 2018, even though the number of deaths are cut down from 2008 to 2018, which means say in those who are non-Hispanic Black, the rate of mortality and the rate of death are much higher than white, American Indians, Hispanic, and Asian or Pacific Islanders. Into even more important to Yang as Black individuals. Say, yeah, at risk for developing heart attack and these cardiovascular disease in T. We will see a take these measures. I bit preventing from getting it very seriously. Now, in terms of management, the infancy will be any coronary artery disease quite basically easy treating. Again, the first step is to try and avoid getting it in the first place, right? And the way you do it is what we talked about with the risk factor modification. But once it will be in your heart attack, it's me a manager and I see you on it's me the stent, a cause blood vessel now, I get blocked now. So they beat me, allow blood to flow again to the heart. Sometimes if you also I have more multiple blockages or different arteries, and usually I require surgery to fix. Now, usually, kind of there are many other medicines I able to me and individuals after they get a stent, and I say as part of treatment for those who get kind of heart attack. Now, kind of just to give an example, right? Say, kasi will be in your heart attack. Into one part, you procedure be a friend heart catheterization to this individual. This is the artery na you kasa about. They supply the lateral part of the heart with blood. Your friend on left circumflex. Into your pretty tight over here, right? Into omokwa no more the stents omo place stents on them. To say I go from being narrow to now patent. And again, this is the concept. Say, so cholesterol build it up, right? It me clog it up the artery. Into yes, blood need to be flow. Into the way to fix it, yes, angioplasty. Now the stent place stent instead of your blood a bit more flow. In terms of heart attack, when you hear about it, this is kind of the usual kind of way in which that is treated acutely. Na ubinya heart attack na CBA yentimi amba hospital in tema it me get dangerous, right? Because that part of the heart it doesn't get enough blood. And say enough blood that part bit me. And yes, and so heart no bit my weak. Na lead to kind of the death of that individual. And these are all very kind of serious things. Say to me, yeah, risk factor no ho ejuma a bit more a prevent progression to kind of this stage of disease. Into kind of this is kind of a very quick overview, since kind of cardiovascular disease in general. Kind of just to kind of bring this to kind of conclusion, going back to First Corinthians 10 verse 31, and say whatever you do, do it all for the glory of God. Into in a kind of a life journey, a health journey, again, the ABI, I was saying, kind of say, body near Yankopon a temple. Now, Yankopon so the above for a purpose. Into a really important say, you better take good care of yourself. So the Ben Yankopon bit man nami so I'm a yes to me abua afoforo. Into again, this is a very quick overview of cardiovascular disease. Next time Yankopon be aduma yibishan, a bit man go into details into kind of other topics. Into and then a day a hanom na a day and then discussion on ABC. Nti ebia any questions bi wɔ hɔnom a few questions a yɛbɛtumi a discuss na nyɛmboa next week so ebia wɔ questions a wobɛtumi a drop in the comment section and we can talk about it too.
All
Meda
right.
mo ase.
Thank you so much, Dr. Robert. Nyame nhyira wo paa.
Thank you,
That was
Pastor.
enlightening. In fact, nneɛma a wɔbɔ boss no yɛ adeɛma a ɛho hia yie paa. Na mede na metwerɛtwerɛ figures no. Wɔ se ɔmo blood pressure no sɛ ɔmo ɛɛte ɔmo body so weight so ko a ɔmo betumi asave 5 milligrams per mercury. Ɛna ɔmo adidie mu nso no ɛno nko ano bɛyɛ 11 minim sɛ milligram wɔ
Millimeters of mercury.
yes. Nti ɛno no
Right.
nso blood pressure no nso bɛte 11 no.
Right.
Nso
Exactly.
woka weight na ɛso bɛte ɛne aduane a wodi no. Eti
Right.
nnuane no I know say bia time will give us. What the ɛbɛfa nnuane no mu a ɛbɛtumi aboa yɛ but in a nutshell no te o say bia ɛbɛhyia no obi sɛ ɔpɛ sɛ ɔlose weight obi pɛ sɛ n'aduane no saa 11 ɔpɛ sɛ ne nsa ka ɔso ɔnom aduro bi a ɔpɛ sɛ ne blood pressure so te 11 sɛ 11 a
Right.
nnuane no hemfa no wɔn hwɛ dɛ bobɔ so kakra bi na afei yɛmfa adesua no mmra wie.
Yeah, it's as we kind of showed in that figure, though, side diet group in front of dash diets. Now, usually consisting of kind of fruits and vegetables, and then kind of grains, kind of and avoiding carbohydrates, like white bread, and it's kind of rich in carbs now. And in terms of weight loss, so kind of the one of the big things I'll be to my boy kind of looking at your calories and monitoring your calories. Kind of as you kind of keep an eye on it, that can also kind of can help with your weight loss journey. But the main diet I recommend either DASH diet and that's a Mediterranean diet, another kind of a diet recommended by the American Heart Association and the American College of Cardiology. I'm going to lose weight. I'm going to blood pressure as I reduce the risk of cardiovascular disease in general.
Yes. And that DASH diet, and I'm
Usually, and more so kind of entails more so, and it speaks more to Mediterranean diets, with kind of a fish and it be a lean meat instead of kind of red meat. And tea, red meat, usually not that recommended, but I think the lean meat, in moderation, I think so will be the key thing.
Yes.
Right.
Let's say akoma no de affect nneɛma bebree. I know say obobo kidney kra so no yen kidney say okɔ Ghana manfo mu nya kidney ewu ni nya de ketwa o. Let's say wo say ni nyinaa no yɛhwɛ akoma mu yi a yɛbɛsɛ wu yɛ kidney. Na wo sa bɔ sɛ nkyene obi wɔ pɛnkyene paa. Bi wɔ a wo nkyene bi a dan wa aduane no ɔsa de kakra gum ka papa na nkyene ba kakra si ne nkyɛn. And also so better say 5.
Right, exactly. Yes.
Let's just say,
Yes.
Doc, I know, say we are going to learn. We need more than say, Obeba, question that I fear that be an Obeba Betty, a healthy nugget, a doctor for Eddie Air Bray, Columbus, a YouTube page name, young programs, na yɛn hu sɛ yɛhwɛ yɛn weight yɛn body no so yie na yɛdidi yie na nkyene koraa de nkyene gu hɔ a saa apɔmuden koraa bɛba koraa nya ketewa wei koraa exercise nso nya maayo exercise deɛ no koraa mantwerɛ nka figure no ho yɛmmɔ mmɔden sɛ nyame ɛyɛ adom a na wɔtwe koraa no fa nneɛma a dɔk ka yɛ no fa yɛ adwuma so ho yɛn nyinaa yɛfa nyɛ adwuma yɛnyɛ exercise na yɛnhwɛ yɛdidie mu yie na menim sɛ ɛbɛyɛ nhyira nti dɔk yɛbrɛ nti ɛnɛ yɛde bɛsi ha This is the
Pastor,
part one. This is the part one.
great,
Nyame ɛyɛ adom next week nso yɛbɛtoa so. Na afei
great,
next week ne bi yɛbɛwura mu yie na afei yɛhu
great.
adesua a ɛwɔ ma nti wowɔ asɛmmisa bi a wode fa gu comment section wɔ Nyame adom a yɛba a ansa na doc ɛbɛhyɛ aseɛ no ɔbɛma yɛ answers to all those questions nti bɔ mmɔden sɛ wode wo questions ɛbɛgu hɔ doc ɛbɛma wabɔ mpaeɛ na afei yɛde dwumadi nyinaa bɛwie.
Pastor, me that's a pan pastor. Pastor, yung bumpire. Yɛn agya a ɔwɔ soro da ɔso sɛ wabɔ yɛn ho ban waka yi na yɛn ho ɔma yɛ privilege ama yɛtumi adiscuss yɛsua about cardiovascular disease. Yɛsɛ sɛ wobɛboa yɛn na yɛ part deɛ wɔ sɛ yɛyɛ a yɛbɛtumi aboa yɛn na yɛavoid getting this disease na wobɛboa yɛn yɛtumi ayɛ. Na deɛ yɛsua yi nso so yɛbɛtumi share with others na ɔmo nso yɛtumi aboa ɔmo health sɛdeɛ ɛbɛyɛ a ɔmo bɛtumi aso wɔ yie. Nti yɛsɛ sɛ wobɛka yɛn ho wobɛhyira yɛn wobɛma wɔ spirit lead yɛn na deɛ yɛsua no deɛ yɛatia yɛbɛtumi put into practice. What your ho now domain set me be share be my yet na sinica be amao. Yet was what do my na we used to be tea. Amen.
Amen. Medin ɛde Pastor Samuel agye ɛnɛ yɛne Dr. Robert Okyere na twetwe nkɔmmɔ. Nyame ɛyɛ adom a next week yɛbɛba na yɛaba abɛtoa so apɔmuden ma ɛho hia wo na wɔtwe fa yɛ adwuma na Onyankopɔn ɛbɛhyira. Ɔnto sɛ ɛbɛhyia mu bio next week no me mpaebɔ paa sɛ me ne wo mmienu yɛbɛhwɛ yɛ apɔmuden ɛho yi. Bye bye.
Bye bye.